at Excelarise, we believe that healthcare transformation is the way of the future. No longer can organizations work in silos. The IT, the business, and the clinical side all need to work together to become a cohesive, holistic group. Integrated healthcare is the way of the future. Clinical, business, and IT really have to work together to provide a comprehensive patient care in a service delivery model. We understand the importance of having that experience behind the organization, and we bring that to the table. Not only we bring it from a clinical perspective. I've been there. I've been a nuclear medicine tech and been able to be there at the patient side. I've been there in an IT perspective, how to bring all this patient data together in a comprehensive format from a PACS perspective, a CPOE perspective, an EMR perspective. I understand the importance of having that information available to the ED physician who's trying to help that patient with that stroke that's just came to the emergency room department, and being able to provide that CT scan, that report, and that comprehensive information for them to provide that continuum of patient care. It's very important to have a true blending of clinical, IT, and business processes together to make an organization run smoothly. So what makes us unique? What's unique is that we look at it from a stakeholder's perspective. One of the key things that I think is so important in any delivery system is the importance of patient data being accessible anywhere and any time. And that anywhere, anytime could be from the physician's perspective, from the hospital perspective, from their subspecialty perspective. Either way, the people who need to take care of the patient need to have that patient information. So one of the key things is to have that integration between the business and the clinical and the IT perspective. From a clinical perspective, you're looking at how can we provide that patient care. What kind of images do they need? What kind of reports? What kind of lab results? How does all these aspects of the patient's care continuum come together to provide that critical aspect of patient care? From a business perspective, you're looking at how long is the patient stay? How is the physician alignment? How do I work with all the different organizations to come together to provide that integrated healthcare? From an IT perspective, they're looking at it from a network perspective, looking at how the communication infrastructure works. How does the network really access the internet? How that information is available to all the other areas in the hospital or healthcare system. I use something called a top-down, bottom-up approach. And what this allows us to do is look at it from two different areas and really pull it together to look at the four distinct aspects where all these things come together. From an organizational approach, you're, again, patient-centric. The goal is integrated service delivery. How are we going to provide that patient with the ultimate continuum of patient care? And that could be the hospital, could be the primary care physician, could be the subspecialty, or even the imaging centers. All these things come together to provide that continuum of patient care. So that's our top-down approach. From a bottom-up approach, we're looking at it from an organizational perspective. How can we provide the organizational infrastructure to help support all the integrated healthcare delivery system we want to provide to our patients? So part of that is the leadership. The leadership has to be on board to really understand how the organization really fits together to help bring patient care. Part of that integrated healthcare system is bringing that business, clinical, and IT perspective together. And part of that all comes together in these four areas: physician alignment, collaboration and joint venture, service excellence, and compliance. Physician alignment is so important because having that alignment between what the physician wants and the hospital or the healthcare delivery system coming together is going to give that unified patient care and continuum of patient care. There might be collaboration between one organization or multiple organizations working together, and all this ties into one key thing for us, and that's service excellence. We at Excelarise believe that service excellence is our number one priority, both from the organization that we work with and our clients and our customers to internally. We believe service excellence is the way to go. Part of that service excellence here at Excelarise is really the core of who we are. And part of who we are is we take that partnership approach and we work with the leadership team to work together to align all the organizational, tactical, and strategic goals and align them with the patient-centric goals. There are four practice areas that we really work on. One is a fractional CIO. We want to power your strategic business with your IT leadership, and we work together to help you with those tactical and strategic goals. We can also do some management consulting, and we can help execute technology-based plans to maximize your investments in your organization. And part of that could be everything from electronic health record to PACS to telehealth, telemedicine, joint ventures. We can help you with all those areas. Other area that we work on is discovery assessments. We have a discovery assessment to help you get from here to there, and part of that could be an IT assessment, it could be a HIPAA compliance assessment, basically help you find those gaps in your organization to help you get compliant or get where you need to be. And finally, there are other areas we can help you with is project management. We can help you project both enterprise projects and small projects. We at Excelarise know that no two organizations are the same, and we can't really use a cookie cutter approach. So our goal is to help look at your organization and help you figure out what's the best solution to fit your needs. We like to do a discovery analysis, we like to talk to your leadership team, we like to really understand your organization and where it wants to be.